Hi everyone, I am Swapnil Banerjee and welcome to the second part of our video series, The Anatomy of Stomach. We are going to talk about the arterial supply, venous drainage and lymphatic drainage of the very important structure of our body, that is the stomach. Before we get into the main part of our video, I'd like to tell you that in the first part, we have already discussed the basic parts, gross anatomy, histology and the stomach bed. And in the next part, we are going to talk about the nerve supply of stomach. So if you haven't watched that part, I shall request you after you complete this video, I shall add the link in the description box. You can go and check out that video from that link. So now let's talk about the arterial supply of stomach. So the arterial supply of stomach mainly comes from the celiac trunk. That's the branch of abdominal aorta. Celiac trunk gives us three branches: left gastric artery, splenic artery and common hepatic artery. Now the left gastric artery supplies the upper part of our lesser curvature, and the lower part of our lesser curvature is supplied by the right gastric artery. That's the branch from the proper hepatic artery. Now coming to our greater curvature, the upper part of our greater curvature is supplied by the left gastroepiploic artery. The left gastroepiploic artery is the direct branch from the splenic artery, and the lower part is supplied by the right gastroepiploic artery. And some small gastric arteries arises from the distal part of the splenic artery. They supply the fundal part of our stomach. Now talking about the venous system. Remember, the venous system completely mirrors the arterial supply, and you will also have to remember the final destination of our venous system is the portal vein. Remember, the left and right gastric veins directly drains into the portal vein, and the short gastric veins and the left gastroepiploic veins drain into the splenic vein. They join the superior mesenteric vein for the formation of portal vein. Now finally, the right gastroepiploic vein, they drain into the superior mesenteric vein. Here's a very important point, that there's also a vein called the prepyloric vein of Mayo. This is a surgical landmark for the gastroduodenal junction. Now talking about the lymphatic drainage of our stomach. Upper lesser curvature that drains into our left gastric nodes, our fundus and the upper greater curvature, and it drains into the pancreatico-splenic node. Our lower lesser curvature that drains into the right gastric and the hepatic nodes. Lower part of greater curvature, and it drains into the right gastroomental or the subpyloric nodes. Now remember, these all nodes finally drain into the celiac node. They drain into the cisterna chyli, then into the thoracic duct, then they drain into the systemic venous system of our body. And that is the main reason you will have to remember that the stomach carcinoma may also cause the enlargement of our left supraclavicular nodes. These nodes are called Virchow's node, and this sign is called Troisier sign. So that was everything for this video. I hope it was very easy to understand for you all. In the next part of our series, we shall discuss the nerve supply of stomach. And remember, that is very important for your academic point of view. Subscribe to the medical files not to miss that video. Stay safe, keep learning, and bye.